Hello, everyone. Thank you so much for joining this information session on the Global Fund Data Quality Improvement Framework. My name is Joanna Barczyk. I am working with the Monitoring, Evaluation and Country Analysis team at the Global Fund. Our team is responsible for providing guidance to our country teams and specifically also to public health and M&E colleagues on how to best use Global Fund funds to strengthen national health information systems, and so, of course, data quality. We came up with this new guidance because the Global Fund came under a lot of pressure on that we are supposedly maybe not doing enough in helping countries to improve data quality generated through their national health information systems. And also because, as you all know, the health information systems are evolving over time. There are some new innovations coming up. So we thought it was a good moment to have a look, see what countries are doing, what are the good practices, what are the innovations that could be promising, and working also closely with key partners like WHO, CHISU, PATH, PMI, PEPFAR. We thought, there is an opportunity on further strengthen collaboration with partners, the funding, but also the technical partners to see how we can further harmonize in supporting the countries in strengthening data quality generated through the health information system. So the result of this all is a new guidance that we have issued this year. And this session is really to summarize what are the key points in this guidance and give you the opportunity to ask questions. So this session will be divided in two. I will have rather a brief overview of the framework that we are proposing, and then mainly also focus on answer and questions from your side, any feedback that you might have in taking up this new guidance. Next, please. So here, no, sorry, if we can come back. Yeah, so here you will also find the link to the new guidance. You should have received it in the email invitation, but here you have also the link. The guidance is available on the external website of the Global Fund. Next, please. So you will know because you are collecting data, you are reporting data that countries you have made significant progress when it comes to data quality or certain aspects of data quality. Here you see 4 metrics that the Global Fund was collecting between 2018 and 2022 as a KPI, a key performance indicator that we were also reporting to the board based on data that you were reporting to us. So, for example, we see that the deployment of the digital HMIS has increased considerably in high impact and core countries. And just maybe to clarify, this data is based on the reporting on high impact and core countries. So 51 countries were in the cohort reporting on these metrics. 98% of countries have digitalized health facility reporting, and that includes digitalization at health facility level or digitalization at a district level where health facility data is being entered into digital systems. We have also made a significant progress in integrating disease-specific reporting in national health information system platforms. So here we specifically look at malaria, TB, and HIV. So we have moved from 45% to 92%, which have been integrated in the digital platforms. Reporting completeness is high at 90%. And then reporting timeliness, which you will also probably know, is lagging behind. We haven't reached, the target that we wanted. It's at 78%. So this is an overall appreciation. It masks, of course, country disparities, but even, disparities within a country. It masks other disparities like reporting completeness. You will know reporting completeness. You might have the reports submitted, but the quality within the reports of the data might vary. There might be a lot of missing data, or where there was missing data, zeros are being reported just to comply with the reporting deadlines. So progress has been made, but more can be done. Next, please. Can we move? Yeah, thank you. So as you will know, the Global Fund has supported countries also in the implementation of national data quality audits based on the WHO guidelines. And whenever it was not possible to implement national data quality audits, then the Global Fund recommended using a simplified well, not really simplified, targeted data quality review, which basically didn't use a nationally representative sample, but used exactly the same methodology than a national DQR. So this slide represents all the targeted and national DQRs that were implemented between 2017 and 2022 with Global Fund support. And you will see that 83% of the data points audited fall actually in the good data quality and moderate data quality. You will also see the variances between the three diseases. Malaria is struggling a little bit more maybe than TB. Next one, please. So progress has been made in many ways in strengthening national health information systems and including data quality. But when we talk to country stakeholders, but also when we have looked at maybe 40 to 50% of the funding requests by high impact and core countries, data quality was actually one of the key elements that was pointed out as a key priority and a key challenge. When we look, for example, also at activities, at the subnational tailoring for malaria, data quality is being mentioned as the key, challenge for, finding out what are the key risks at subnational level and where to invest. So the challenges remain. We think as well, having reviewed the funding request, and this is maybe also due by the way that the Global Fund operates and other partners operate as well, is that there is often a lack of systemic approach to data quality because we tend to, finance things through a disease lens. We have a lot of interventions within the disease grants. But when you think about it, data quality is really a systemic issue. It's not about a disease. If you have poor data quality at facility level, if you don't have the tools available, if your person hasn't been trained, and very often it's the same person reporting on TB, HIV, and malaria and vaccination data. If the person is struggling with understanding the indicators, it's not just about the disease. It's really an integrated approach that needs to happen, we think, in building the foundations of a national health information system. We have also seen in some of the funding requests that data quality investments and even wider data system investments have been deprioritized. And we understand it. Difficult decisions need to be taken because we have limited funds and we will have more and more limited funds going forward. And so it's understandable that, you rather prioritize maybe activities that show a short-term impact, like, investing in commodities like pediatric ARTs that are really very necessary. And then data quality and system interventions are deprioritized, may even be put entirely into the above allocation. But you have to think about it that it's a long-term investment. And in order to know how many drugs need to be bought, you have to have a system that can produce you good data with good data quality, in order to avoid, a lot of resource wastage if you buy too many commodities because your data quality was poor and you waste a lot of money. So a long-term investment in eventually may actually turn out in, efficient resource use. And for a long time, we have to admit that, data quality investments were perceived as, let's do a national data quality audit, and this is, the way we invest in data quality. But this is really not good enough, because the data quality audit is just really the starting point. There needs to be much more focus on what comes afterwards, the resolution of the issues that have been identified. And there has probably been not enough attention paid to it, maybe not enough investment being done in it. And we also think that there needs to be a greater focus on the routine data quality improvement. We really need to have ways of looking at data quality immediately or as soon as possible after it has been collected, so we can take action as soon as possible and rectify it before the data goes and flows up the chain of the health information system, and really address the root causes promptly and at the data collection point. We think that there are great opportunities. We are in a digital era that provides opportunities such as digital platforms. We have opportunities of, having new measurement, more, fine-tuned measurement of data quality. We can use analytics that are embedded in digital platforms like dashboards at different levels of the health pyramid, not only at the national one, but we can now go down to the health facilities where countries actually have digitalized data collection. And it helps us also in the monitoring of the progress. And there is also, as I mentioned, an interest among partners to further harmonize data quality approaches. WHO convened in December 23 a partner consultation on data quality approaches, the innovations, and really there was high interest of really trying once again to further harmonize around simple tools, avoid fragmentation in the way that we are supporting the countries. And as you know, and you probably feel, there is a global push of service integration, of having, service integrated at the service provision point. And we think it's an opportunity at looking at how we do data collection, how we do data quality interventions. There is probably a great opportunity of looking into how we can better, even further integrate systems that would lead to, stronger systems, unified systems, and also find efficiencies. Next, please. So this is a graph that you will see in the document, in the guidance, that really summarizes what we are proposing to you. This graph has nothing Global Fund specific, or maybe just one little thing that I will call out, but it's really informed by what you countries are already doing about innovations that are already being implemented or are in the pipeline. And we really wanted to rely on those, not introducing anything Global Fund specific, and really see how these, existing tools, not a lot of them, can be really taken up by the countries in order to improve data quality generated through your national systems. So we have proposed to outline the interventions looking at the 5-year strategic planning cycle, because in many countries, your national health information strategies follow a 5-year cycle. So in this 5-year cycle, we would recommend that you would start with the implementation of a national data quality review, if you have the funds, if you have the resources to do such an intensive activity. If it's not possible, you can always, rely on the targeted DQR, which is implemented by the Global Fund LFA. And it's the same methodology. It's just a smaller set of of health facilities. But even if it's a smaller set of health facilities, usually between 20 and 40, it could already give you a good appreciation of what your data quality bottlenecks are. And in many times you will already know what they are anyway. But these assessments really allow you to have a starting point. And that assessment, it's not a standalone. It should lead to the development of a data quality improvement plan. And even if your data quality at national level is good, at subnational level, you will probably see variations. So it's really an opportunity of having a more tailored and targeted approach to data quality, as we are seeing in the disease responses as well. Because you will have districts, you will have facilities that will perform better than others, and you should really focus your investments there where the gaps are greater. So the data quality improvement plan can be either embedded fully in your national HMIS or health information strategy, or if that alludes to data quality but is not detailed enough, it can be an addendum. But in no way does it replace a national health information strategy. So what we are proposing are the following activities. First of all, there is the annual desk review of the WHO data quality assurance approach that you will find on the WHO website. The desk review has been integrated into the DHIS2 platform in late 2023, and countries can run it automated on an annual basis. What it contains, you will see on the right-hand side, where we listed the metrics available through these different approaches. You will have completeness, internal consistency, external comparison with other data sources, and external consistency with population data that comes out from this annual desk review. We are alluding a lot to DHIS2, but please understand that any other digital platform could basically integrate these activities, and we strongly recommend so if you have other digital platforms in your country, to see how you could embed some of these activities, data quality assurance activities, in your existing digital platforms. Then we have many countries are implementing the routine data quality assessment. It's a supervision tool that has been provided by the late Measure Evaluation. Today it's CHISU. And this tool has been digitalized. It has been digitalized by many stakeholders. We have several editions of this tool. One has been developed by West and Central Africa. One has been developed by CHISU, and PATH, which is an implementation partner helping a lot of countries around the malaria response, were working on one as well. So what we have tried is bring them together and have a harmonized routine data quality assessment digital platform. It's available and ready to be piloted. And the idea is really to have one tool that the countries can adapt to their setting. Ideally, of course, we recommend to implement it in an integrated way. But when it's not possible, because of the different funding sources, one partner brings only malaria funding, you could always explore, approaching the Global Fund, whether the Global Fund could complement for the other diseases. You could also approach Gavi, whether they would like to piggyback and implement this digital platform in an integrated way. You can tailor it to your needs, whichever indicator you want to go and verify. But I think this tool provides us an advantage. It includes a planning app where you can display and plan for your supervisions. So you see where the supervisions are being planned, which have been implemented, which are forthcoming. So you don't also overlap with other supervisions that might be potentially planned in the same health facilities or districts. You can compose the teams that go on supervision. And then you go out and you supervise, you collect the data on your digital platform, either through phones or tablets. And then you can synchronize with the DHIS2 platform, and the results of the supervision become immediately available at whatever level of your health pyramid, be it national, regional, district, or even if you have DHIS2 set up at health facility level. And this is the great advantage, because when you implemented your RDQA in the Excel format, I would say that probably rarely countries compile the data and analyze them systematically to have an overview what's really happening. And the digitalization gives you immediate results. And you can follow up on the recommendations, because the application caters to the setup of recommendations. Next time when you go and supervise the same health facility, you can see whether the recommendation has actually been implemented. So I think it gives a lot of advantages. And the measures that we get from the national DQRs or the digital RDQA are either an external verification factor from the DQR, or the advantage of the RDQA is that it gives you an internal verification factor. Internal in the sense, it's not because the RDQA is being implemented by the stakeholders within the National Health Information System. It's not an external audit, but still it gives you an appreciation. And if there is a quality assurance of the implementation of the RDQA, I think we can really trust the verification factors that are being compiled and can complement the availability of this measure on a more frequent basis. Then one activity that we think has great potential is data analysis and use at district and health facility level. Many countries are implementing on a monthly or quarterly basis data validation meetings. These data validation meetings in many settings really look at the data, whether they are good enough to be reported up the chain, and they are just sent up once they have been validated. But not a lot is being analyzed and really dug into understanding what are the bottlenecks, how can we improve the implementation of the shortcomings. So through a catalytic investment in Western Central Africa and Southern and Eastern Africa, we had two projects. On the Western Central Africa side, it was implemented with IEDES, and on the Eastern and Southern Africa part, it was implemented with Makerere universities. We came up with data analysis and use protocols for these meetings to basically look at what is your data quality, look into what is your programmatic performance, why am I underperforming, doing a root cause analysis of the underperformance, and coming up with clear action points on how to improve, first of all, data quality and your programmatic implementation, really interpret the results that you are seeing and take action. And these protocols are being available, and the reference is available within the document. And we really would urge countries to see how the existing meetings that you are already implementing, that are in many settings paid for by the Global Fund and potentially other partners, how to improve the methodology to look at these different aspects. And we have also worked with University of Oslo in coming up with a data quality toolkit within DHIS2. It had become available in October 2023, and we would really urge countries who use DHIS2 to set it up, because it has a lot of new or improved functionalities and new metrics as well. You can report data on data set completeness, data set timeliness, data element completeness. You can look into consistency over time, consistency of related data. There is an outlier analysis. you can look into external consistency and then consistency of population data. Some of these metrics were already available, but some of them are new. And what is new as well, we have requested UIO to come up with data quality dashboards for the district and health facility level, so that during these monthly or quarterly data review meetings, these dashboards can be used and help the analytics and the discussions that are happening. One thing that we also started engaging in with partners is based on a good practice in some of the countries who started coming up with a data quality composite index, basically combining different data quality metrics that they have in the digital system and give a data quality score of the data that they have. We thought that was an excellent idea, and we are now engaging with UIO and also WHO and then other partners to see whether we can come up with something standardized that could be used across the countries. As you know, some of the data quality metrics, they are not available as frequently. So this data quality index could be a proxy of the accuracy of data. We also have at some times countries that they are more and more moving to fully digitalized health information systems. So that could also be a proxy measurement of the data quality within their fully digitalized system. And then, of course, over the cycle of these 5 years, the interventions that are applicable to your countries would, really require a close monitoring of the implementation of your data quality improvement plan. And at the end of the strategic cycle, you would, perform another data quality assessment, either a national one or a targeted, or the assessment of your national health information system to inform the next strategic cycle. So we really would avoid implementing the national DQRs more frequently than once in 5 years, because what we have seen with supporting the countries, it's very resource intensive. Depending on the country context, the exercise may actually take up to 2 years from the beginning of the planning until having the results report available. And then, you have to invest in the improvement measures, and that takes time. So doing it more frequently, there is not enough time to really see any progress. So we rather would recommend to invest in routine data quality assessment opportunities to improve your data quality at country level. Next, please. So this is also a graph which is included in the guidance. We think that data quality assurance really starts at the data collection points. And here we have listed the different levels of the health pyramid up to the Global Fund, where we think it's important to check and guide your data quality investment, whether you have invested in whatever contributes according to what we think data quality. And that starts with the availability of the data collection and reporting tools. That continues with job descriptions and SOPs that really describe the data collection journey up to, from the data collection up to data use for the different levels, training and supervisions. And this for all the different levels, depending on as well where you start digitalizing your system. So it's really important when you think about, asking for investments in your national health information system and data quality improvement. Look at these different activities, whether you have funding for them, whether there are gaps, and the Global Fund could help fill those gaps. It's not just about data audits. It's really at seeing how you strengthen your basics of your national health information system at all the different levels of the health pyramid. At our level, we have, at the Global Fund, we have introduced some new tools as well. Once the data from the countries comes to the Global Fund, we have set up some data validation rules that help us also identify some challenges in data quality in the reporting that we see from the PRs, so that we can easily feedback to the PRs and improve also that stage of data reporting, and in order to get the best data quality that afterwards we are also using in our results report that is being reported also back to our donors, and helps us also to mobilize funding for the next funding cycle. Next, please. So in a nutshell, really the key recommendations that will vary on the maturity of your respective health information system. So there are 4 points that we would really like to stress is to please think about having a national data quality improvement plan following a data quality assessment that can be national, that can be targeted, that can be embedded in a surveillance system assessment or an HMIS assessment, but really not to stop there, but think about having a national data quality improvement plan that is targeted and looks also at a tailored approach to sub-national findings, because they will vary across districts and health facilities. Then, if you have a digital platform being used, and here it's specifically the DHIS2, we urge you as soon as possible to set up the data quality toolkit and start using it, because it gives you new metrics, it gives you new dashboards, and it gives you new opportunities to more routinely look at the data quality that is being reported through the DHIS2. It also gives you an opportunity, you had data quality metrics in your existing DHIS2, but it gives you an opportunity to revise how things have been set up. Is there an opportunity for improvement? So it would be really helpful. And we also, those that use different digital platforms, we really recommend in looking at whether you have data quality assurance metrics or activities set up, like the data validation rules, dashboards, analytics, so that you can monitor this in other digital platforms as well. For those countries who use the RDQA for data-related supervisions, we really recommend moving to a use of digitalized RDQA, because it gives you more advantages. And most of all, it will allow you to using the results of the RDQA, which in its Excel form was quite limited. For other countries who would like to introduce this, of course, you are welcome to refer to this routine data quality tool app in the DHIS2. And if you are interested, please reach out to your country teams. We can help set up information systems on this application to have it implemented in your country. And then, very importantly, most of the countries know it and they acknowledge it. The data analysis is key, but when it comes to really making it a reality at subnational level, at the periphery level, district and health facility, it's often still not the case. So really, we urge you to look into your existing methodologies for data validation meetings at district and health facility level, and see how you can improve those, to look at data quality, to look at programmatic performance, interpret the results, decide on the actions to be taken to improve your data quality and your programmatic performance for the best use of your resources, and having also an impact on your data quality, because we strongly think by using data, your data quality will be actually improved, because you will own the data. And if there are funny things that you see, you will go back and correct that data. And this can also help you. This practice can help you improve some of the strategic approaches that you are implementing for malaria, TB, and HIV. It can help you in improving, the subnational tailoring, frequent monitoring. Is the progress being made at the local level towards the strategies that have been identified during subnational tailoring for malaria, or for example, for TB, your active case finding are the results progressing? How can we further improve to find your TB cases and to keep them, have them follow the full course of treatment, but also for differentiated service provision for HIV. How are the different strategies being implemented? How can we improve them? Next, please. So this is a summary of data quality metrics that will become available once you start implementing the updated data quality toolkit. In bold, you have new metrics which we think going forward would be important to measure due to the caveats that I have mentioned at the onset of this presentation, that reporting completeness, we have a high performance, but the reporting completeness is hiding the quality of the data elements reporting, missing values or plenty of zeros, which are no zeros. So for countries that are going and using digital systems and are implementing the updated data quality toolkit, we really recommend to start using these new metrics like data element completeness. Keep an eye open to, we will be coming back to you with a proposal on the data quality index once we will have a proposal together with technical partners so that we can pilot it in interested countries to see whether, there is buy-in from you, whether you think actually that this is actually, useful. And then, as you implement the digitalized data quality assessment, routine accuracy measure becomes available that can be used to also, inform where you need to pay greater attention on the accuracy, improving the accuracy measurement. Next slide, please. So all that I have just presented comes, of course, with roles and responsibilities at different levels. So we see four different stakeholders. So in red, you will see national stakeholders. So national stakeholders that are National Health Information Directorates, that are the disease programs, that might be in other implementation partners, so PRs, but also technical partners, other implementation partners at national level. In blue, you will see responsibilities for the country teams of the Global Fund, and specifically public health and M&E specialists who closely work on data quality and health information strengthening investments with the countries. In green are assurance providers, activities that could potentially be implemented by our assurance providers, Global Fund assurance providers. And in purple, that's MECA, that's us, so our monitoring and evaluation country analysis team that provides guidance. So the circle of the data quality improvement framework starts really at country level by the country stakeholders, by developing strategic plans aligned with technical partner guidance, such as WHO. We strongly recommend, and it's done in many settings, developing a multi-donor implementation roadmap, so you have clear visibility on who can contribute to what are the funded activities, but also what are the potential gaps that still need to be filled, and that you can, resubmit, for example, to the Global Fund during reprogramming opportunities. Then you would submit a funding request to the Global Fund, it potentially also to other donors. The country teams support you in taking up the strategic interventions, making sure that those are the priority interventions aligned with technical partner guidance that are applicable to your specific EPI context and country context. We provide guidance during, so MECA team provide guidance during this stage as necessary. And then we also define what potential assurance activities would need to be implemented by our assurance providers. Then we come to the implementation stage, which is happening now during GC7. You implement the activities, and assurance providers may do assurance activities if it's deemed necessary. It's important for the country stakeholders to really perform routine analysis on data quality, but also program performance, especially at subnational level, and monitor your performance, but also see how the absorption of the MNU module progresses, so that you can reinvest in new or existing gaps to make the best out of the MNU module to strengthen your health information system through GC7. And the Global Fund country teams, of course, monitor the progress. They try to discuss the existing bottlenecks with you, see how during reprogramming funds can be reinvested, and the bottlenecks can be resolved as much as possible. And we, again, the MECA team provides guidance to reinvestment if necessary. And at the end of the cycle, you would do a periodic assessment on how your health information system strategy did, how your data quality implementation plan was implemented, to inform the next cycle of implementation and submission to donors for funding. And of course, we cannot succeed without everyone in this cycle playing the role. So really, the success on health information investments, but particularly in data quality, really depends on everyone playing the role fully in this important cycle. Next slide, please. So in the guidance document, you will have some supportive guidance included. So we have referenced as much as possible existing guidance with links, easily accessible. If there should be any bottlenecks in accessing any of it, please come back to us, either through your country team or to MECA. We have also included a decision tree on guiding you through which routine data quality intervention and investments to focus on in your specific context. There is also guidance on for funding requests and reprogramming. What are the activities that we recommend you to consider when you work on these elements? And then the new metrics on data quality that are becoming available through system upgrades. And we are also referencing the forthcoming WHO data quality framework. Next slide, please. So I have mentioned that WHO had organized a partner consultation in December that was very well attended by key partners and donors. And as I mentioned, there is really huge interest in further harmonizing on how we support the countries. The result of this will be a WHO country data quality assurance framework. Our data quality improvement framework fully aligns on this framework, so we don't deviate. And this framework is in its stage of finalization, and it will soon become available. So I'm sure WHO will be disseminating this framework with everyone but we will be helping that as well through our country teams. We will let you know once this becomes available. What we would like to call out for is we are looking for countries who would be interested to pilot the approach with partner support. So there is interest to work together between WHO, Gavi, GFF, and the Global Fund. So in your countries where you have these partners and you would really like, you are interested in implementing some of these or most of these interventions, please reach out to your country team and tell them that you are interested. And we would be more than happy to support you in the uptake of these activities the best we can throughout, contributions through different partners. We have one country that could potentially fulfill this criteria. It's Guinea, but if any other countries are interested, please reach out to us. Next slide, please. So this is the end. This is really the summary of what you will find in the document. And now let's move on to the Q&A, please. So the first one, what sample of countries was considered? So our guidance document focuses on high impacting core countries. This is where the big bulk of Global Fund investment goes. This is where we have an interest in having data quality improved because this is where also some progress is more required. But the guidance can be applied by focused portfolios as well. Whatever they see fit to their context, they can pick and choose. But our focus and our support will focus on high impact and core countries, just prioritizing our resources as well. Next one, data validation and cleaning. What are the best practices for data cleaning and validation in DHIS2? I don't know whether we have somebody from UIO. They have been invited, and I don't know whether we have someone, but I would like to call on UIO to respond to this question. Do we have somebody? If you can speak up. Or HISP? No. Okay. So in that sense, I will try to respond on their behalf. We have been sharing this, the invitation to this session with them. They wanted to attend, but maybe they couldn't. So I will give a simplified answer. But data validation and cleaning. So there are new elements that you can use. So you have, you have data validation rules that you can set up. In DHIS2. So either you have them set up already, and some of you maybe haven't even processed to setting them up. And these are part of the data quality toolkit in DHIS2. So if you haven't set them up, you will start from scratch, setting them up, when to validate data and, data inconsistencies. You can program that data inconsistencies are being automatically picked up. And you will get notifications when there is data inconsistencies. For countries who have already set up data validation rules, it would be good to go over them again and whether they have been set up correctly, whether they are, not too many in numbers, whether you have the key ones, whether they can be improved. And linked to data validation as well is the notifications. You can set up notifications that come to you based on data validation rule violation. And you need to be mindful that these notifications, they need to be set up correctly as well, so that your inboxes are not overpopulated, that they come through the right channel, because they can come either through email, they can come through WhatsApp, or whatever means you will be setting up in your system. But you have to be also smart about it, because if you start getting too many notifications, people will start disregarding those. So it's really, you know, important that this data validation and respective notifications are well set up, and that they trigger action, that there is somebody at the other end who receives these notifications and goes back and cleans up the data in the system and takes action to correct the data. So I hope I have answered that question. But that can be, you know, further fully discussed when you proceed to setting up the data quality toolkit with support from the HISP groups. They can guide you throughout the process. Data security and privacy. How can we ensure the security and privacy on sensitive data in DHO as far as tracker programs are concerned? Again, this is something that you know has to be. It's a very valid point and needs to be considered. And we really encourage you, you know, through the setup or improvement of the trackers, that you address this concern with the TA providers, so the HISP groups that are supporting you. And they are so they have developed this data quality toolkit for aggregate data for the time being, but they are looking into data quality functionalities within the tracker systems as well. So I think this is something that that they will be looking into when developing guidance on data quality for the trackers. So this is forthcoming, and hopefully we will have something available shortly, but it hasn't been done for the tracker yet. But this is a very good point, and thank you for pointing it out. Yes, next one, could we have this presentation? I think we can share it with you after this session, and the recording will be available as well. So you have the link already provided where you can access both the presentation and the recording. In what ways can AI technologies enhance data quality across key areas such as cleansing, validation, analysis? Yeah, that's AI is all over in many ways. So I think this is something that we will have to explore going forward. This is also why we need to really keep our hands on the pulse as things start evolving, and health information systems and data quality assurance alongside it is an evolving area. And we have to look into what are potential AI opportunities that we can bring into the spectrum of activities. For the time being, yeah, I don't think we have anything apart from, you know, some of the automatization, the automatics and the analytics, but an area that we should look into moving forward. Which data quality approach will work well in integrated settings where TB, malaria, and HIV are integrated into the national health information systems? So here, all of which we have mentioned, because we strongly think that data quality approaches are systemic. So if you look for, you know, the data desk review, the WHO desk review, which can be automated if you are using DHIS2, it is an integrated approach. So it covers all the 3 diseases and beyond. When it comes to the digital RDQA in DHIS2, it's for the country to set up. You can choose which indicators the district level goes and verifies at health facility level. And we really recommend looking into doing these supervisions in an integrated way. It all depends on how your you know, reporting is set up in a country. But if you go to the health facilities, many times, according to the health facility, it's going to be the same person. If it's you know, a smaller health facility, it's going to be the same person who collects the data, all the health data, and is responsible for the reporting. In a bigger health facility, you might have maybe a different data collection points, but it could still be one person who consolidates the data from the different services, compiles the data, and sends it up further. So we think the digital RDQA should be implemented in a integrated way. But there might be other donors who can, for example, invest only in malaria, because that's the focus of the funding. And in such cases, we really recommend you to explore with Global Fund country teams. If some districts are covered for malaria data quality assurance with the RDQA, then maybe the Global Fund can come in and complement if there are funding gaps to collect data on TB and HIV. And maybe Gavi would be interested in supporting the vaccination data. They are interested in quality data as well. So it's really for the country to see, I think, how to be more efficient, because we know in the future there will be less funding, and use the resources that you have in the best way available. And we think that integration could be such a way. And the tools that are available, they can be used in an integrated way. The data quality toolkit as well, it caters to all the health information data you have in your DHIS2. So it's not disease specific. And the data analysis and use approach at district and health facility level, the protocol I was referring to that we developed and is available and referenced in the guidance is integrated, because at district level and at health, especially at health facility level, you will look at your data in an integrated way. Maybe you will have some disease specificities, but we think when you look at your data, you should look at across all the services that you are providing. So the methodology is integrated. It's not disease specific, but then you have to look at your health facilities and your district level as well. What are the health priorities within your catchment areas? In some districts, HIV and TB might be more relevant than in others. And then you would maybe include more HIV, TB related indicators to be analyzed during your data review meetings. Whereas maybe malaria is everywhere across the whole country. It really depends on your EPI context. And I think the EPI context need to be really also used to inform what kind of data you look at your subnational level, because your disease distribution will vary. Next one, the DQR tool lacks triangulation component. When you want to assess supplies, anti-malarials released from store, pharmacy, dispensed to people. Absolutely, I agree with you. And this is where we suggest, the available tools can be improved, and based on the feedback that we are getting. It's an improvement cycle as well. This is what we have now based on the current situation, and we will improve based on the comments we are getting, based on the opportunities like the AI comment we got or the triangulation. And very important to have data quality on, on supply, on the lab information system, of course. This guidance, and I mentioned, maybe forgot to mention, is about programmatic data. And you are rightly pointing out that we need to also look at data quality of other information systems within the HIS. And where we see we can look at different, sources of information is exactly at this data analysis and use opportunities, these data review meetings, where you should start triangulating data. And we have actually tried to integrate, supply chain information that is being looked at when you analyze your data quality, but also your programmatic performance. And you look at your supply chain information as well, and you start triangulating it, because it's not happening. It's not happening enough, and this is where we see also a good entry point, where you bring also the other data sources into your data review meetings, and you discuss it, you analyze the data, you look also what are the gaps in your respective information systems, so that you can also bring it up to the donors, but also to the other specialists on our country teams, like the HPM, the health product management specialists, so they can also see what are the gaps in the respective information systems, so that we improve availability of data across the different data sources, but also the quality of the data across the different sources. Next one. One of the key challenges in the DQR and data quality improvement plan is the availability of human resources. What are your key recommendations on this? Absolutely. It's the availability of human resources and the quality of human resources in the sense of, capacitating, investing in your human resources. And this is something that it's difficult because the Global Fund, and we try to invest in sustainable approaches, and there might be these discussions. We cannot replace the Ministry of Health responsibilities in paying for human resources, but at times it will be necessary, and this should be brought up with your country teams and see what would be really required. If you need more human resources, and some of the portfolios have invested in human resources that support data collection activities, but these human resources should not focus then only on data collection, but then also data analysis, data interpretation, and action taking. And this may be required at different levels, not only at the national level, but mostly it will be at the subnational level. So it's really, making an assessment when you do your data quality improvement plans and look into the human resources gaps. And this is also where you have to tie back into the human resource investments of the Global Fund, and looking at the sustainable investment of the human resources as well. You have to have the human resources in place, but you need to also capacitate them through trainings, through mentoring, through supervision, so that there is a continuous improvement of their capacities. We know that there is also a brain drain. We also know that they are highly mobile, and we are losing human resources as they are moving around. So it's really also tying back to the investments in the strengthening of the national health, the RSSH investments, where human resource investments, including those that work on data, need to be addressed. But absolutely correct. That's one of the caveats and the challenges that we see, that we don't have enough, and it should be brought up and see what is feasible through different funding sources. Next one, data quality improvement plans have been done for some of the countries. What measures do you recommend to be observed to ensure that actions agreed upon are acted upon? So the data quality improvement plans, that depends, it's true, they have been done. They might vary in the terms on on the details that have been included, and what has been also outlined as a monitoring practice. So you might have indicators, and I think you should have indicators, especially those that we have mentioned when you use digital systems, moving to more sophisticated data quality metrics that should be part of your data quality improvement plan. What are the metrics and what frequency will be reporting against those? But you also need to look at the activities. Have they been implemented? If you, for example, want to set up the data quality improvement, data quality toolkit in the HIS2, has it been set up? What are the different steps that lead to it? So it's technical assistance from HISP, then it's the setup and the training at national level. Then you have then you have the cascade training, and then are the products that, the data quality dashboards, for example, or the data validation rules, are they correctly being used? So it's about monitoring activities that are in your data quality improvement plan, and this should be monitored at the agreed upon frequency, which should ideally be specified in your data quality improvement plan. We recommend highly to piggyback on existing working groups, because we know that there are many working groups at country level. We don't want to increase the number of those, but many countries will already have an HIS technical working group. So, data quality is an entire part of HIS, so it could be monitored through that working group. But it's true that this needs to be owned, and this needs to be fully taken on board by the respective stakeholders, and should be owned and looked at the agreed upon frequency. Same with your, national health information strategy. You should have frequent meetings looking at how you are doing. So we would recommend to really piggyback on those, because they are so much interrelated. During the same avenue, look at the implementation of your data quality improvement plan. Next one, a beneficiary verification of work done at community level is not done fully. What are the Global Fund plans? Absolutely right. The Global Fund has worked closely with WHO on, extending the data quality review methodology to the community level. A draft of the tool exists, and I think it hasn't yet fully been piloted for lack of funds. But we are looking now, working with WHO and UNICEF in piloting the data quality review approach for the community level. And we think as well that we see a great opportunity, as many countries are trying to build digitalized data collection at community level, that there are opportunities within these platforms to set up some data quality assurance measures. Or in some countries we have digital supervisions for community health workers being set up. So we really recommend countries to see whether data quality assessments can be implemented in this community health worker supervisions, because it's just a setup. It's adding some questions. They can be quite simple ones. What did you collect and what did you report, and having a verification factor. So we are looking into those, and there will be more to come, but nothing precise at this moment. And I don't know whether we have somebody from WHO, Anne or Caroline. If you are on the call and you are happy to speak up, please do so. Next one. Gulia. Hi, Gulia. Well, what is changing between GC6 and GC7? We are trying to innovate. A lot of is, the same approach, in the sense that, yes, countries, we recommend to do national DQRs whenever possible. Having said that, we have, it's a solid methodology, but we have also seen there are caveats in the national DQR implementation, because it's very time consuming, it's very costly. It looks at retrospective data. And what we have seen, not always do countries proceed to the development of a strong data quality improvement plan. So too much focus on the audit itself, but not enough focus on what follows an audit. And this is for us where actually the focus should lay, on what is done with the findings. And so we have also done external quality assurance of some of the DQR implementation, and we have seen the data quality of the DQRs is not always up to standards because it's a heavy lift. It's a heavy lift, and it requires, a quite resource investment. So maybe, whenever possible, we still recommend to do one, but we also started a reflection with technical partners. If we will implement digital RDQAs and countries will have adopted that methodology, we could potentially look into, whether we can aggregate RDQA accuracy measurement up to the national level when we have assured the quality of the RDQA implementation and we introduce some, sampling into the aggregation, we could potentially come up with accuracy measure for the national level. So in the longer term, I think it requires reflection whether this is the right way to go. For the time being, we still recommend it until we have an alternative. But we will be thinking through this with the technical partners, because we think with the innovations, there may be, less time-consuming and more efficient ways of getting the same what the national DQR is doing. Targeted DQR remains an option in settings where national DQR cannot be implemented because not enough resources are available or because of the political context or implementation concerns. So this can still be performed. We still think it's a good enough tool to give us an appreciation to give us and also to help the country develop a data quality improvement plan, even if the sample was not nationally representative. You will see it's good enough because you all know what the issues are, and I can tell it, like that. What in most of the settings your data quality issues are. So this is still the recommendation. What changes is the frequency. It's true that WHO, I think in the original guidance, they said, do the DQR, national DQR, every 3 to 5 years. What we have witnessed from country implementation is that it's very time consuming and a lengthy process. In many, many settings, it takes up to 2 years. So we think it's not realistic to have a DQR every 3 years, because that doesn't leave you enough time to implement the implementation, the improvement measures. And we know that because it's systemic interventions, it will take time to show results. So we say implement, if you want a national DQR, every once in 5 years, at the beginning and at the end of a national strategic planning cycle. The targeted DQR, because it's implemented with LFA funds, it's up for the country team to decide, not more than once in a funding cycle. And if no data quality concerns, it could be spaced out as well, at least once in 5 years. That's the change. So it's the frequency. What we are proposing are systematically implementing innovative interventions. And these are digitalizing your RDQA in countries that are already using the RDQA in Excel format, using systematically the data quality review app within the HIS2 based on the WHO portfolio once a year. And that's new. It's focused on data analysis and use at subnational level, at district and health facility level, because data analysis and use will improve your data quality, but it will also improve your implementation and lead to greater efficiencies. And this is so much needed in the scarce resource context that we are facing. I hope I have answered your question, Julia. Next one. Yes, so the targeted DQR is available. We are looking into, we are piloting this tool in a couple of countries. So we are looking at some countries where we have CHISU and PATH implementers, because they are very keen in going together and pilot this tool together. So we have Burkina Faso, Mali, Ivory Coast, Togo, who has expressed interest, and some countries potentially in Eastern and Southern Africa to be confirmed with our country teams. But any country who is interested can reach out to the country team and we can consider its use. And it's available. So it's going to be piloted, and we expect that there will be some fine-tuning throughout the pilots, but we are ready to go. The only thing which is now we just need to sort out with the countries that I have listed is the contracting, which is never an easy way for the technical assistance of DHIS2 app implementation, so with the different HISP groups. And we strongly recommend, yes, to work with your HISP groups in your regions in the setup and implementation of the RDQA. Yeah, so the pilot, the challenge of parallel reporting platform, EDSR, case notification, absolutely. I hear you. And this is maybe not the data quality improvement framework that will help you in doing this, but this is maybe something that should be looked at when you do your HIS assessment before you plan your next strategic cycle. And during that assessment, I think it's really noteworthy to see, look at, potential fragmentation that is still being the case. What are the potential integration opportunities? Absolutely agree that surveillance systems, we should look into how we can further integrate, how we can deduplicate some of the data collection that is being generated through, the different surveillance system not being integrated. And this is also something that we would like to look into through Global Fund. And for GC8, we are looking into how could we, provide further guidance together with technical partners, how we can address that, because it's a real issue. So it's maybe during those opportunities you can point out, overlap and further integration. But we could, so in these pilot countries, it could be brought up as I'm just thinking out loud here. When we look into countries who would like to pilot this approach, we could potentially look into this additional element of parallel reporting platforms on how it could be addressed in these pilot countries. But I think you should still look into, when you assess your national HIS every 5 years, at this point, look into this as well. We can look into that when we do the pilot approach, because what we have seen as well, the multiplicity of reporting tools, because sometimes, these registries or reporting tools, they are done through a fragmented disease-specific approach. So there are some omissions, and because some data are missing in a register, then a separate register is being developed just to cater for 2 additional data points that have been missed. I think there is really a need to profoundly look at data collection, really how data collection is being done at the number of registries and how they further can be streamlined. And I think also, data disaggregation, how do you data disaggregation based on a paper format? You cannot ask for the same level of data disaggregation like when you have a digitalized system. So I think these are all elements that we could potentially look into based on the country needs. So this is a very good point that you brought up. But I also invite you to look into this when you assess your national health information system. And in some countries, we have made assessments of, the digital platforms, and, in some small countries, you come up with 100, more than 100 digital reporting platforms. That's really scary. And when you develop your digital health information strategies as well, this is potentially also, an entry point in doing an assessment. What is out there and how can it be streamlined? So it needs to be addressed from different angles, but absolutely a point that needs to be addressed. And we will be looking into this, how we can further help countries in integrating. Okay, and then the last one on the slide is please explain how ADEX can be relied on for data quality. So for those who don't know ADEX, so what the Global Fund tried to do, we introduced ADEX. It's a direct reporting for countries who have DHIS2. We have linked up, the reporting to a Global Fund DHIS2 instance, and countries who wish can report through this platform. And we have now about 12 countries who have set it up. So it's basically, mapping what you have in your national HMIS, mapping towards Global Fund indicators of the performance framework indicators. And then it gives the opportunity to countries to directly report through the ADEX interoperability platform. It doesn't give the Global Fund access to your national health information platform. It's just a link, and countries click on a button to report to the Global Fund. And because it's a DHIS2 platform, we recommend whenever you set up, you proceed to ADEX reporting, you immediately set up the data quality toolkit within your DHIS2. And this is how data quality will be improved for the data that is being reported through ADEX to the Global Fund. Because you will run the data validation rules, you will set them up, you will run them, you hopefully will start using the data analytics dashboards at different levels that will trigger, action to improve your data quality, correct the errors that you find, outlier analysis, and everything which is available in the DHIS2 platform. So this is how we see that data quality can be improved. And the other thing is through ADEX reporting, we have set up data validation rules on our end. So whatever is coming through the ADEX and hits our data validation rules, that's how we can also provide feedback to the countries on what needs to be fixed when reporting through ADEX. But the most impactful is setting up the data quality toolkit in your DHIS2, because as you improve data quality within your DHIS2, the data quality running, the data going to the Global Fund through ADEX reporting will be of better data quality. Next, please.
Joanna, we have these two more questions and a hand raised, and we only have a few minutes left before we finish.
Yes, so I would like to hand over to Anne if you can, if you want to comment.
Thank you. I was about to, because I have to go in 3 minutes for another meeting. But thanks a lot for this session, but also for answering all the questions. And just a quick introduction because I joined late. So my name is Anh Chu, and I'm coordinating the work on the data quality and the data quality toolkit at WHO in Geneva. So I think Joanna has covered almost everything. I just wanted to highlight and also links to a couple of the questions about the triangulation, but also now there are so many different initiatives on the data, especially for the surveillance. So one of the key things that also mentioned is one of the key dimensions of data quality, which is the consistency. That is something that we can also look at that from a routine basis, as well as this, when there is a data from other sources. But what I also would like to highlight here is just repeating and underscoring what Joanne said, the routine data, quality assurance, the steps you take, the use of the data, that would determine a lot on the data quality improvement process. It is a process, it's not something that the tools can give you immediately the data quality because you have used the tool. It is what we use the tool, what we use the results or the key finding of the tools that would help to building into the routine data use, data checking, data validations. And that is a practice that need to be practiced. Particularly, you need to repeat it. And I think from WHO, also from the partners, we've been trying to say there's a lot of example out there, like in Tanzania, like in Uganda, where you build it into as part of the data review and on a quarterly basis or even on a monthly basis, because what being scrutinized is what going to be improved throughout the course of it. And also touching on the AI as well as on the validation. With the DHIS2 tool, a lot of the validation rule has been built in. The question is, are you looking at all of those notice or flags that the validations and the system give it and raise it at the end of the month? Would there be a human resource there to take it up and to address it before you submit the data to the next level of the reporting? And the same with AI, what coming in and is the quality of the coming out of the AI. So at the moment, we do not have a lot of materials to build something that we can say we fully rely on the AI. And the data use is what is going to be determined the quality of the data on the longer term. And the work that Joanna has together with partners and the University of Oslo to try to bring in some proxy and some understanding of the data quality. It's just another way of, for you to flag it up and also for you to realize that there are certain issues that need to be addressed, but then we still have to break it down. We still have to look at the source of it and to build the capacity at the facility where the data is entered. And with digital, if we enter the data, we register the data wrong, then the damage is even bigger. So I think it is important to realize that at the source of it is what matters, and the use of it, not just to look at the data, but also use of it for decision making, for planning would help a lot. And with that, I think also I've flagged it up for Olaf, Joanna, so he might be able to join you online to answer some of the questions for the DHIS. And thank you.
Thank you, Anne. Thank you for joining as well. Do we have another hand up?
No, we don't. We just have the last two questions. John,
yes.
I don't know if you if people can stay a couple more minutes.
Yes. So on the question from Hudson, because on Dennis I need a follow up to understand. So CLM data quality is also lacking. Yes, it is lacking. Our advice, CLM data, data quality is as anything, other data reporting that you are thinking about. You need to have the tools. You need to have trained, people collecting the data. You need to, supervise how they are collecting the data, and you need to start using the data. And I think if you ensure that in your CLM data reporting, it is already a good data quality assurance. We don't have any specific guidance in terms of it, but as something that I have noted. But I think it's the basics as for any other reporting systems. You have to have the key elements in place, assure data quality through some supervision, some mentoring, and then data analysis and use, because it may point to some issues as the data is being collected. But we can think about it if there is anything else specific. And we are also, welcoming any feedback on it through, through your country teams. Feel free to reach out to us if you have any good practices. The guidance that comes from us is as good as what we are learning from you. So it's really based on what countries are doing, the good practices. So this is something that will be evolving, and we can look more closely into it if needed. So Dennis, on your question, I'm not sure I understand. Does the tool support manual data entry from external systems? Which tool are you referring to, and what do you mean by external systems? if you want to clarify your question.
Thank you very much. Just to clarify, so the DQA tool is DHIS2 based. I imagine in fact, it's an actual situation where one country was struggling to verify which of the two case numbers were correct. One was from, say, a weekly surveillance system that was using probably a different DHIS2 instance. And then you have the monthly HMISOM that's integrated with all these other disease areas. So the country was struggling to decide which of the two case numbers are correct. So if the DQA tool is DHIS2 based, is there an opportunity to say, okay, well, it has automatically picked the number of cases for the month, but if I have access to a weekly system, I could also enter the number of cases for the 4 weeks and then have that sort of discussion around either at district level or facility level. If these are both coming from the same primary source, why are we having different numbers? Where is the problem? Over.
Yeah, so of course the DHIS2 data quality toolkit won't be able to pick up which is the right number if you have two different data sources. What is helpful is the digital RDQA, because it allows you, it's from the district to the health facility level, you go into the health facility and you look at your primary data collection tools that are they are mostly paper-based, and you recount what has been reported. And if at that point you have, and then you compare it with, the reporting through the different channels, and then you can see really which data is the accurate one. But if you, and I think this is important to look into, why are these variances and how they can be fixed. But for that one, I would imagine you would need to go to the health facility level and look at the primary data collection tools with the RDQA approach. I don't know whether I answered your question, whether that was...
Thank you. It's well answered. Thank you.
So,
John, I think that was it. If you want to close the session, thank you.
Thank you. Thank you very much. Thank you, everyone, for having participated in this session. It's great to have had such a great turnout. We hope that this guidance will help you to better, tailor the data quality and system investments that you are asking from the Global Fund. And we are here to support you. So do not hesitate to reach out to your country teams. If you have any further follow-up questions or you want any specific support, we are really here to support you. And we hope that we will continue, collaborating with you with further improving your systems and the quality of the systems, the data quality that is generated through your systems. Thank you very much. And thank you also for our communication team who ran this session. Thank you very much. Have a good afternoon, everyone.